right, welcome everyone to our first Suicide Prevention Center of New York State, part of the New York State Office of Mental Health's Coalition Academy for 2025. And some of you might notice that beyond some of friends and colleagues in New York State, we have some folks actually from around the country who are joining in, and appreciative that we're able to offer this opportunity to talk about extremely important work going on in rural areas. You know, there's going to be a concentration on some of the work happening in New York State, but the work that Jeff is going to be talking about in just a moment has application and impact nationwide. For those of you who are not familiar with the Suicide Prevention Center of New York, we are the public-facing efforts for suicide prevention in the public health clinical realm. My role specifically is working with communities and coalitions and some other statewide efforts, and we support our local suicide prevention coalitions with technical assistance and support, occasional funding opportunities. And one of the ways that we support them are through these coalition academies. They're basically lunch and learns. So we hope that you folks find this of benefit and value. And with that, I am pleased to introduce our speaker for this afternoon, Jeff Winton. Jeff is the founder and chairman of Rural Minds, which he'll be talking about, which is a national 501c3 nonprofit organization. And they serve as an advocate and informed voice for mental health equality in rural America. Due to a family tragedy, Jeff devotes a significant portion of his time and energy to fighting the stigma, suffering, and silence caused by mental illness, and helps rural Americans tell their own personal stories to assist others on similar journeys. In addition to being the founder and chairman of Rural Minds, Jeff is the founder and owner of Wall Street Dairy LLC, a working family dairy farm in Chautauqua County, New York, and a member of a multi-generational farm family. For those of you not from New York State, Chautauqua County is in the southwesternmost portion of the state. Beautiful. If you ever get a chance, if you're not from New York State, and you have an opportunity, I would highly encourage you to make it to Chautauqua County. Just beautiful rolling hills, beautiful farmland. And with that, I'm going to turn things over to Jeff. And so folks know, we're going to be building in some time for Q&A at the end. I will be tracking questions as they come up in the chat function. And we should have ample time to respond to anything. But with that, I'm going to go off camera, and I'm going to formally welcome Jeff to the stage, as it were. And thank you, Jeff, for taking time out of your day to talk about the important work that you're doing.
Thank you very much, Gara. And I certainly appreciate the opportunity that the Office for Mental Health New York has given us to have this discussion this afternoon. This discussion is becoming more and more important as the days go on. Certainly every morning we wake up and hear about something else that has happened overnight that is having an impact across the country, but exponentially having an impact in rural areas. So as I shared with Gara earlier, we're busier than we've ever been because a lot of the changes that are taking place in Washington. So it's a pleasure to be with you. As Gara said, I'm from a long line of dairy farmers. I'm sitting here talking to you on our dairy farm in Mayville, New York, which is the county seat. Some of you may be familiar with Chautauqua Institution, which is 5 minutes away. And in fact, I'm doing a town hall meeting there tonight on a very similar topic. We are a national organization, but we are based here on my farm in New York. And so even though I spend a lot of time doing this in other parts of the country, and in fact traveling. I was in North Carolina a couple of weeks ago giving a talk to a big group of farmers. I would say more of my time than not is spent here in New York. This is where I'm from. This is where I live. This is where my family story begins. And this is where my heart will always be. So I'm very proud to be an upstate New Yorker. And I do hope you take Gara's invitation to come over and visit beautiful Chautauqua County. We've got a ton of snow here right now. If any of you are skiers, if those of you don't like winter may want to wait until June or July. The fall is very pretty here, but the winters can be very severe because we're right on Lake Erie. Some of my colleagues from Rural Minds have joined us, but others, I saw some other names of other people that we work with from across the country. So again, it's a real honor to have the opportunity to share this message with other people, both within New York and in other states. Next slide, please. Gara's advancing the slides because as I shared with him, it's anyone's guess what I would be pulling up from my desktop. So I always appreciate some help when it comes to PowerPoint presentations. This is a picture of my nephew and his then 3-year-old twins. It was taken in Niagara Falls. You might be able to see the falls in the back. Those of you who have gone on Maid of the Mist or have gone to the falls can probably recognize the hallmark blue slickers that all three of them are wearing because it gets pretty wet there. So a week later, my oldest nephew, Brooks's brother, was married at a typical farm family wedding. It was held at the Gary Rodeo Grounds here in Chautauqua County. The rodeo grounds is a prime place for farm families in this area to have wedding receptions, birthday parties, anniversary parties, retirement parties. So it stood to reason that we would have his brother's wedding there. And it was a picture perfect September day. It was September 1st, 2012, as a matter of fact. And it was one of those days where it was still warm enough that the cattle were out in pasture here on the family farm. The corn was ripening and it was a beautiful golden color right before harvest for silage, which is what, of course, we use on a dairy farm. And some of the wedding pictures were taken with the cornfields and the cows behind. So it was just one of those family mountaintop experiences that we all talk about and hope for in our lives. So the wedding was beautiful in the little country church where my family has been members of for many, many generations. The reception was a ton of fun. Of course, all kinds of music and good food and everything else. And as I was getting ready to leave the reception that night, after having said my goodbyes to the wedding party, my nephew, this young man you're looking at right now, Brooks, came up to me and in his signature way gave me a huge bear hug. And this was a big guy. He was 6'7", weighed 280, star football player, star wrestler, if they could find anyone big enough to wrestle him in high school. And he came in very handy on a family dairy farm because he literally could pick the animals up himself and move them if he needed him to. So he gave me this big bear hug, looked in my eyes, and he said, "Uncle Jeff, I just want you to know how much I appreciate everything you've done for me and my family." And he had the two little kids here with him, who again were 3. And I didn't think anything of it at the time because he was a very grateful young man who always showed his appreciation for anything anyone had done. So it was typical of Brooks to do this. So that was September 1st. September 2nd was a fairly unremarkable day on a family farm. You know, we get up at 5 o'clock in the morning and start our chores very early because the cows have to be milked and the calves have to be fed. And those of you who have grown up on farms or live on farms know the routine. We were also planning my mom's 75th birthday party the next day. So that was keeping us busy in addition to kind of decompressing from the wedding and getting ready for just the fall harvest here at the farm. But September 3rd, the next day, again, less than 24 hours after the planning for my mom's party and 48 hours after my other nephew's wedding, is when the world changed and when my family was practically destroyed for forever. So again, 5 o'clock in the morning rolled around. We're doing chores. At that point, we had 3 dairy farms here in the area. We've subsequently have consolidated things. So I'm going from farm to farm, just making sure everything's going okay. So as I was leaving the last farm and was heading back to my home, which is on the main dairy farm, I went past my nephew's house, my nephew who you see on the screen. And as I approached his house, I saw red flashing lights. I saw police cars. I saw EMT vehicles. I saw an ambulance. I saw fire trucks. And I knew something terrible had evidently happened at Brooks's house. So I jump out of my pickup truck, and the woman who I had grown up with, who lived right across the country road from where my nephew lived, came running over and grabbed me with tears running down her face and said, "Jeff, don't go any further. I just found your nephew in the backyard of the house, and I think he's dead." And I'm like, "What do you mean, Renell? You think he's dead?" "I just saw him 2 days ago. I just talked to him yesterday, and everything seemed perfectly fine. He's 28 years old. He's a farm kid. He's very healthy." And she said, "Well, we're waiting for the coroner and we didn't have your number. So that's why no one had called you yet." Well, in the meantime, I start calling the rest of my family. Everybody comes to my nephew's house. The coroner comes. And in fact, my nephew is dead, and he had died by suicide in the backyard of the home where his 3-year-old twins played. And at that point in time, and those of you who work in suicide, and I know that's the majority of you, you know, time stopped. It was something that I will never, ever forget as long as it has happened and as long as I live. And certainly it's something that has had a major impact on my family. And so the reality started to sink in that we had just gone from a wedding for his older brother to now planning a suicide for a seemingly healthy 28-year-old that just seemed unfathomable. So we gathered at the local church and we're sitting in the pastor's study. And the pastor looks at us. I'm there. My brother, his father, is there. My mother, who had helped raise them, was there. And the pastor looked at us and he said, "I don't quite know how to tell you this, but there are people here in the area that don't think you should be talking about the fact that your nephew, your grandson, your son died by suicide." He said, "I even had someone go as far as saying, well, maybe the Winton family should say he died in a farm accident or he died of a heart attack or something like that." And my mother, my late mother, who was the true matriarch of her family, with tears running down her face, and she was a very kind, very gentle woman. So this was completely out of character for her, pounded her fist on the pastor's desk and said, "Pastor, this is going to stop with my family. This has been going on in this farming community for way too long. We know we've had all these unexplained deaths, especially of young people, and no one will talk about it. I'm sorry. I've told this story hundreds of times, and I still am reliving that day with my mom and her courage." And so the next day, the funeral took place, and my mom asked me if I would give the eulogy. And as you can imagine, giving an eulogy for a 28-year-old who you deeply loved, he was more like a brother to me than a nephew, was a very difficult thing to get through. And we did talk in detail as much as we knew. Now, keep in mind, we had no idea that my nephew had been suffering. He seemingly was a happy guy. He was very outgoing, very gregarious, bigger than life, loved his kids, 3-year-old kids. He was in the process of buying his first house. He worked here on the farm and he also worked at one of the local steel mills on Lake Erie. He was the last person, the very last person in our family that we would have expected would have been struggling in silence. We had somebody else in our family who had attempted suicide a number of times. So my family had been focused on that person, never having any idea it was this fun loving guy who you wanted to be around. That was the one who was living with this terrible illness, but didn't feel comfortable even talking about in a close farm family. So I somehow got through the eulogy. And at the end of his funeral, we had other farm families in the area for hours, lined up, telling us their story, telling us stories that they had been ashamed to tell, telling us stories that had been hidden for generations in these farm families. Again, my family has been here for a very long time, and we have been in the same area for a very long time. So everybody knows my family, especially in agricultural circles. And we had people say, well, if the Wintons can talk transparently about this, so can we, and we're going to. So it was my mom's courage. It was my mom's love for her grandson. It was my mom's candor and my mom's transparency that planted the seed for an organization now known as Rural Minds. I've had the good opportunity and the privilege of working in the healthcare industry for a good part of my career. And so I had worked in mental health. I had worked for companies that were involved in mental health. So I started reaching out to a lot of other organizations I have a great deal of respect for, organizations that are partners of ours today as the work we're doing in Rural Minds. And I asked the question point blank. I told them the story. They knew me, of course, from my past association with them. And the question I asked them was, what are you doing for people living in rural America? What are you doing for farmers? What are you doing for people that work in the fishing industry? What are you doing for the indigenous people? What are you doing for the Amish? What are you doing for people that work in forestry? And every call was met with silence, very respectful silence, but with an admission that they really hadn't focused on the 46 million people that live and work in rural America. They all admitted they knew there was an issue. They all admitted that something needed to be done. But many of them said, you know, we know how to reach people in LA, we know how to reach people in New York City, but we don't know the first thing about reaching people in your farming community of 500 people in upstate New York. So it was really with the encouragement of these other national nonprofit organizations that we launched Rural Minds, because we realized there was no other advocacy organization that was solely focused on rural America. Next slide, please. So 3.5 years ago, Rural Minds was founded. And again, as Gara said, we are a 501c3. We're the only nonprofit organization focused on mental health equity for the 46 million people, or 14% of the population here in the United States. That's a very large portion of this country. And so we have been working very diligently the last 3+ years to ensure that people understand the unique challenges that we face in rural areas. Many of you just seen who was signing on, you come from the same kind of farming areas that I do. You know the struggles that people in rural America face. And so I know in many ways I'm preaching to the choir. But we also do a lot of work with non-rural audiences, because it's very important that people in urban and suburban areas, people who are very well connected, people that are very powerful, especially in the government, knows that life in rural America is not a beautiful, bucolic existence without any worries in the world. It can be a beautiful place to live. And quite honestly, at this point in my life, I'm not sure I would want to live anywhere else. But I know firsthand how difficult life can be in small towns and how underserved we are when it comes to healthcare, especially mental health. And so it's important that non-rural, non-farming communities understand what we all live and work through each and every day. Next slide, please. So our mission is to serve as the informed voice for mental health in rural America and to provide health information and resources. We're very proud of our website, which I hope you will go to after we're done, and that is ruralminds.org. We have spent the last 3 years building our website, and aggregating a lot of information, including a lot of information from, I'm sure, some of your organizations by category in a easy to find place for the people we advocate for so that they can go and do this on their own. Those of you who work in rural areas know that people in rural America are very proud, very independent people. We're taught from the time we're little kids to pull ourselves up by our bootstraps, to not ask for help. It's a very difficult thing for people to do, especially when it comes to anything related to mental illness or substance use disorder. So we have tried to make our website as easy to use as possible with a lot of resources on there that people can use if they don't feel comfortable going and seeking help. And even if they do feel comfortable going and seeking help, there's a lot of supplemental information on there. Our vision, which I know is very lofty in this day and age, is a rural America where there's no more silence, suffering, or stigma around mental illness. Again, most of you know that mental illness is still highly stigmatized in rural areas. We don't consider mental illness an illness, despite the fact that it's called mental illness. We are not comfortable talking about it publicly, just like the story I told you about my nephew and other people that came up to us at his funeral. We will talk about cancer. We will talk about heart disease. We certainly all talk about COVID these days. We talk about diabetes. And we don't try to hide the fact that someone is going through treatment for prostate or breast cancer. But we do not want to talk about depression. We do not want to talk about alcohol use disorder. We do not want to talk about schizophrenia or psychosis. And we've got to get comfortable being uncomfortable and bringing these illnesses out of the dark recess of the closets where they've been hidden now for decades and generations. Next slide. Compared to urban counterparts, rural Americans have a higher depression and suicide rate, but much less likely, I should say, to access mental health care services. The statistic that we've seen recently from the CDC, and we're actually working with the CDC, I believe we have a meeting with them tomorrow, is that people in rural areas are 64 to 68% more likely to die by suicide than people in urban or suburban areas. And young people in rural areas are 54% more likely to die by suicide than young people, their counterparts in suburban and urban areas. So we've got a real issue on our hands. And I'm very concerned about how it's becoming exacerbated by a lot of the things that are now happening as a result of some actions that are taking place. Next slide, please. And I'm going to put my glasses on for this one. Vanity's out the window. I've already talked about the one statistic. Farmers and ranchers, people I associate with being a dairy farmer, are twice as likely to die by suicide as other occupations. And so that's why when we launched 3 years ago, we started with the farming community because we've got a real issue here that is only getting worse. It's certainly not improving. I talked about young people, and suicide rates in young people are growing much more quickly. We're in conversation with a number of youth organizations. I'll be talking about this in a bit, and even some local high schools near where I live that are having all kinds of issues, as many of you know, with their student population. And they want to partner with Rural Minds and see what we can do to help them from a programming standpoint. Next slide, Gara. These are statistics that are on our website, so you don't have to worry about taking them down, but 3/4 of rural counties across the country have no psychiatrists. Psychiatry is something where you've got an aging population of providers who are in psychiatry. We are hoping that younger people will start going into psychiatry. A lot of young people have gone into Other forms of neurology have gone into oncology, certainly have gone into cardiology. We need young people coming into psychiatry because we have a real issue there. We have a problem, and again, I know you folks know this, we have 20% fewer primary care physicians in rural areas. I just made an appointment this morning for something fairly routine, and it's going to be a several week wait before I can get into my primary care physician. We have an issue with broadband, and I normally at the beginning of a talk like this warn people that at any point in time my internet service could go down because, again, I'm talking to you from a farm in rural Western New York. 30% or 3 out of 10 Americans in our country have no broadband or have broadband that is less than ideal. The Farm Bill, which has been lingering in Washington for well over a year, and in light of what's happening, will be lingering probably till at least the end of this year, has provisions in there to help improve broadband service, to ensure that more families have internet service. But until such time that that gets passed, we're in a real problem. So while telehealth helped a lot of people, including myself, in this country, a lot of people don't have that ability. Believe it or not, we have parts in this country in rural areas that don't even have cell service. I was doing a program in Southern Illinois, a very rural town of 300 people in Southern Illinois near the Indiana and Kentucky border recently, where they don't even have cell service down there. So cell service is something that the rest of us take for granted. But again, we have a lot of areas in rural America that don't have some of the modern conveniences that would be helpful during a time like this. Next slides. So these are some of the challenges that are going to sound pretty familiar with most of you. Again, as I mentioned before, we are taught to be self-reliant in rural areas. We are taught not to ask for help. We are taught not to talk about sensitive topics because it isn't polite. And that's one of the reasons we still have the stigma that exists. In small towns, I always tell people we have the best of situation and the worst of situation. The best of situation is that if something happens in a small town, news travels fast and people gather around to help you. That was certainly the case when my nephew died. But the flip side of that is if you have something you don't want people to know about, if you have something that you're ashamed of or embarrassed about, such as, a diagnosis of major depression or substance use disorder, you don't want that necessarily spreading around a small town. And people have good intentions, they want to help, but unfortunately, everyone knows everybody's business in a small town. And I say that respectfully. As I said, there's a positive side to this, but I've had many people tell me that even if there was a mental health clinic in my small town, I probably wouldn't go, or I'd have somebody drop me off because everyone knows my pickup truck. If my pickup truck is parked outside the local mental health clinic, the news is going to travel fast that John Doe must be having some kind of a mental problem because his truck is parked outside the clinic. Difficulty getting an appointment, I've already talked about that. And transportation is a huge problem. You folks know that. We don't have train service, we don't have bus service. Here in Chautauqua County, at least, we don't have Ubers, we don't have taxis. So if a person needs to travel any length to go to get help, many times it's impossible. It's not like if you live in a suburban or urban area where you have mass transportation. And even if you do have reliable transportation, many people in rural America are self-employed, they're farmers, they work at the local feed mill, they're people that work in education, they're people that do things where they can't just up and leave a job like people that work in big companies can and take a couple hours and travel to the local provider, wherever that person may be. They're hourly wage earners in many cases. And I think it's on the next slide, please, Gara. But many people in rural America are uninsured or underinsured. I had someone very recently, a very prominent farmer in the Midwest, tell me a heartbreaking story. He said he lives with type 1 diabetes, but he also lives with major depression. And he said, I can't afford insurance because I'm self employed. I'm a farmer. So he said, I'm paying for all of my medicines and all of my medical help out of pocket. And he said, so I had to make a decision between getting treatment for my diabetes or getting treatment for my major depression. And he said, I know the diabetes will kill me if I don't keep on medicine and get help for that. He said, very likely the major depression is going to kill me at some point in time as well. But he said, I can't afford medication for both. I had to make a decision and I chose the diabetes medication. That was just heartbreaking for me. In a country like the United States of America, people should not have to be making those kinds of decisions. Pharmaceutical companies, many of the companies I've worked for, have patient assistant programs that every time I get a chance to talk about, I make sure that people know that they exist. And if a person meets certain criteria, their medicines can be made available to them. But unfortunately, a lot of people don't know about that. So they go without. And as a result, they have to make these kinds of decisions. And again, I'm not going to go down the political rabbit hole here, I promise, Gara, but some of the decisions being made in Washington right now really scare me and concern me as someone who advocates for people living with mental illness and people living in rural areas. If the Affordable Care Act goes away, if Medicaid is impacted, that is a big part of how people in rural America are getting their health care currently. And people in rural America take much more advantage of the Affordable Care Act and Medicaid than people in suburban and urban areas. And so this is going to have a dramatic impact on us if some of this is impacted. Feeling of isolation. Living in a rural area can be beautiful, but I would dare say in a winter like we're having right now, at least over here in Western New York, I'm getting tired of being surrounded by snow up to my chest and not being able to get certain places that I'd really like to go to. So I'm feeling the isolation myself. And I can't necessarily walk to the next door neighbor because I don't have a next door neighbor. I don't have anywhere that I would have if I was still living in a suburban or urban area. And so people started feeling it, I would dare to guess, during COVID. We all started feeling isolated during COVID. So even people that lived in non-rural areas felt this. But people in rural areas, especially certain times of year, when they may already be living with seasonal affective disorder, are certainly feeling the impact of feeling isolated and not having some of the outlets that people in other parts of the country have. Next slide, please. I'm going to try to speed up so we've got some time for Q&A. Next slide, I've already kind of gone through that. So the Rural Mental Health Resilience Program is a program that we launched a year ago in conjunction with the National Grange. The National Grange is the oldest and largest agricultural nonprofit organization in the United States. Some of you may be familiar with the Grange. They're located in 1,500 communities across the country, and many are here in New York. I spoke at the New York State Grange meeting over in Oswego recently. There were several hundred people there. So the Grange has been a very important partner because they're already part of the fabric of rural America. They're already where people go for trusted information and credible information. So when we launched Rural Minds a little over 3 years ago, we knew we needed to partner with an organization that was already in rural America, where people already trusted what they could learn in those areas. And so the Grange has been a critical partner with us. And those of you who live in New York, which I dare to guess is most of you, if you've got a local Grange in your area, I would highly recommend you reach out to them. I'm a member of the Grange in Fredonia, New York, which was, by the way, a piece of trivia, the very first Grange in the United States. So we've been doing some programming through our local Grange. And if you don't know where your local Grange is, please reach out to me. I'd be happy to put you in touch with them. Next slide. This program, the Rural Mental Health Resilience Program, you can find on our website, on ruralminds.org. These are just some of the very beautifully designed and written pieces that people can find that can be downloaded and printed and used for town hall meetings, for church meetings, for 4-H and FFA meetings. The program I'm doing at Chautauqua Institution this evening, I have printed a number of these pieces that I'm using. We've tried to make this as easy as possible for people to utilize. It's really a meeting in the box, if you will, so that people can have a meaningful conversation with their family members, with their friends, with their neighbors. Again, knowing how independent people are, we know they won't necessarily go to a support group meeting in a nearby city, but they may go online and may access some of these materials. So I would ask you to look for these after the call is over. Next slide. This is a new program that was just launched in November, again at the National Grange meeting in Iowa. Chuck Strander, executive director, who's on the call with me, is spearheading this. And we are doing the trial program here in New York State, which again makes me very proud. Our partners are the National Grange, FFA, which many people still refer to as the Future Farmers of America, FFA, Cornell, my alma mater, and the FarmNet, which some of you may be aware is a wonderful organization I'll be talking about here in a bit. And this is a peer-to-peer program because we know young people are more likely to talk to other young people, especially about something like mental health, than they may be willing to talk to their parents or their teachers or other adults about. So our goal is to equip young people with the tools that they need to be able to help their fellow young people. A statistic I saw recently again was heartbreaking that in the last year, 20% or 1 out of every 5 high school students has seriously contemplated suicide. So we have a runaway speeding train right now with young people, and we're hoping that this program that we are in the process of launching will be helpful in this regard. So stay tuned. You'll be hearing more about this. Next slide. This is our newsletter. Our new newsletter just went out yesterday, as a matter of fact. So I would ask you to go to our website and sign up for the newsletter. You will get, hopefully, what you will find a lot of helpful information and an idea about the work we're doing here in New York, as well as in other parts of the country. If since the new newsletter has gone up, I'm not sure if you sign up today, if you'll get the current newsletter, but if you don't, at the end of it, I will give you my own email address. You can email me and I will send you the new newsletter that was just distributed. We also just distributed our new progress report that kind of shows the work we've done over the last year, but even over the last 3 years since we were founded. And again, these pieces can be found at ruralminds.org. Next slide, Chuck. Our Rural Minds Connections webinar series. We've done a number of webinars on a number of topics, from postpartum depression to a filmmaker from the Buffalo area who did a film called Mother's Day, which is a story about his mother's journey and what happened on a particular Mother's Day, and many other topics in between. These are all archived on our website, and we've got some new webinars that we're working on right now that if you sign up for our newsletter and become part of our database, you will get notification about. But we do ask you to look at some of the past ones. We're very happy and very proud of some of these. Next slide, Chuck. Sorry, I keep saying Chuck. Chuck is our executive director who normally does this for me, but Gara has kindly offered to do this. So my apologies.
All good.
This is just a snapshot of many of the organizations that we are working with currently. You'll see a lot of logos that you know, such as NAMI, such as MHA, such as DBSA, the American Foundation for Suicide Prevention, certainly. We're working with a number of agricultural, for-profit and nonprofit organizations, and we're working with a number of pharmaceutical and for-profit healthcare companies that obviously have a vested interest in ensuring that the 46 million people that we represent, that we advocate for, have the latest and the most cutting edge information at their fingertips. And I would dare to guess that this slide is probably obsolete because almost every week we add a new partner or two. And so this just gives you some idea of kind of the breadth and the depth of the partners we've developed. And we're really a cross section between the healthcare industry and the mental health, rural health industry, because people, I always say, living in a rural area, especially farmers, if they're on a particular medication and they are owning a farm, they likely will also be buying a John Deere tractor. They may be sending their milk to a local cooperative. So it's important that all the entities that they interact with are working collaboratively and aren't trying to do things in a silo or in a vacuum, that they're all partnering. We have something called the Partnership Council that brings all of these groups together. And the very first meeting we had, which was again 3 years ago, it was an epiphany for so many people because the healthcare people had no idea who the agricultural people were and vice versa. And they realized they were trying to reach the same people to help them, but they were doing this on their own, if they were doing anything. So now when we meet on a quarterly basis. We've got the next meeting coming up very soon. It's a love fest because these people now know each other. They're now collaborating. They're now working together because they realize that they all have a common goal, and that's to reach people in rural America with a message of hope and help. Next slide. I've already talked about the Grange. This is, again, another program that we did funded by Pfizer, the big pharmaceutical company, most of you know. But this is a program that you can find on our website that was done in conjunction with USA Today. USA Today, the newspaper, ran an article about what we're doing again to reach rural youth. And there was a very well done video, if I must say so myself, because part of it was filmed here at my dairy farm in Chautauqua County. And that video can be found on our website. So this is a program that, again, was just launched a couple of months ago that we are hoping will continue. We're doing another program with Pfizer right now on loneliness and the impact loneliness is having on people in rural areas. We did a program with them right before the holidays on the holiday blues, and how, as you folks well know, during the holidays, we're all expected to be joyous and happy and, on top of the world. And for people living with mental illness or substance use disorder, that's normally the exact opposite. So we did dozens of interviews on the radio with both urban, suburban, and many rural radio stations, myself, as well as the medical director from Pfizer. And we reached several million people that we're hoping was helpful in our efforts to reach people that haven't necessarily been reached before. Next slide. I think we're almost done. FarmNet. I would be remiss if I didn't talk for a few seconds about FarmNet. FarmNet is a program that the people at the Office of Mental Health know quite a bit about because they're a partner of theirs. It's funded by the state of New York as well as by parts of Cornell University. And this is a program that's been around since the 80s that was put into effect during the last farm crisis to help farmers that were struggling financially. It is a program by which people that work for FarmNet, who are either trained financial consultants or trained mental health providers, go to a person's farm, goes to their family home and talks to them. So that again, that stigma I talked about before, people don't have to worry about where their cars parked. And so the people that work for FarmNet provide free financial services. But what they discovered soon after launching the program back in the 80s is that many of these people were struggling with depression. They were struggling with alcohol use disorder. They were struggling with other things besides just financial instability because of what was happening during the farm crisis. So it's a program in full disclosure. I'm on the board of, and I'm very proud of that. But there are dozens of these wonderfully dedicated people across New York State from the end of Long Island up to the North Country, over here to Western New York. It's a free service, it's a confidential service that if you don't know about FarmNet, please contact me or go to the FarmNet website and learn about them because it's a unique program. It's unlike any other program in any part of the country where we do work. If I'm speaking in Montana, if I'm speaking in North Dakota, I always bring this program up, and every time I bring this up, you can see people salivating, saying, we need something like this in our state. So, as New Yorkers, we should be very proud of this. And I would, again, strongly urge you to take a look at this program. Next slide. We've got a new program with Cornell. You can see we've been pretty busy the last 3 years since we've launched. And this is primarily focused towards the veterinary community. We have a big problem with suicide amongst veterinarians, as many of you know. And again, in full disclosure, I serve on the Dean's Advisory Council for the vet college at Cornell. And the dean of the veterinary college has a real heart and a real passion for helping not only equip his students, but to then help them once they're out practicing veterinary medicine. So, again, if you go to our website, you will find information on this. It's a free online course that's available to anyone. Again, it was launched initially to help the veterinary community and those who live in rural areas, but there's a lot of other helpful information. And again, it's a free course. And as I tell people, where else can you get a free Ivy League education? So please do go to our website and look for this. I think you'll find it very helpful. And FarmNet was another partner in this program. Next slide. Next slide. We've already talked about a lot of this. There should be a slide. Here we go. So this is my direct email address. I highly recommend you reach out to me at jeff@ruralminds.org. Sign up for our newsletter. We're very active on social media. Those are some of the icons of the channels we're on. But we need you. You folks are in the trenches. You are fighting the good fight. You are the people that are ultimately saving lives and helping people here in New York State. And so it's been a privilege talking to you. I want to spend the next few minutes answering questions you may have. And certainly, Gary, I'd ask you to send the questions that we don't get to me, and we will make every effort to get back to everyone. But thank you for your time and your attention. And most importantly, thank you for what you do every day. And Gary and the Office of Mental Health, thank you for inviting us to speak to this group today.
Jeff, first and foremost, I wish we weren't meeting under these circumstances, that you have a story about your nephew. And you've mentioned the term story a number of times, and I just want to acknowledge that I think we need, as you said, and as your mom so eloquently said, we need to tell these stories, right? And so thank you. What an honor for your nephew, right? So thank you for that. Um, there's some great questions that I'm going to surface right now for you. So let me get to that first one. Do you find that migrant workers are in the same boat as the farmers are with mental health concerns and the barriers to access mental health treatment? Do they face this on a grander level for language and insurance barriers?
They base this on a grander level for a lot of reasons. Certainly not only the reasons that you rightfully so pointed out, but again, we're living in a time where everyone is concerned about what's going to happen to them. And migrant workers are critical to agriculture, especially here in New York. They pick our grapes by hand, they milk our cows, they're harvesting vegetable crops, they're taking care of sheep in Eastern New York. These are a very important part of our workforce, both the documented migrant workers as well as the undocumented migrant workers. And so migrant workers were already disproportionately impacted because of some of the factors and some of the barriers, including language, as you mentioned. But I really am fearful now. And I've heard, quite honestly, from a number of the very large dairy farms here in New York State who employ a number of these migrants that their labor force is basically disappearing and they can't find anybody else to work on a farm. Working on a dairy farm is hard work. I know. I grew up on one. I live on one now. Most people in our country don't want to be doing the hard work that's inherent in a dairy farming operation. And so, fortunately, we had a lot of migrant workers who raised their hand and said, please put me to work. I'm thankful for the opportunity. And now they fear for their lives. Now they're being rounded up. And again, I don't want to be political about this, but it's a harsh reality of some of the things happening that our migrant workers are under great duress and great fire right now.
Thank you, Jeff. Stephanie from Oneida County, her coalition is working to get into the rural communities to help reduce stigma, build relationships, get folks connected. A major barrier is that folks in the rural communities do not trust us because we are city people and they don't want to travel to the city for services. Any tips on how we can begin to build trust and relationships?
That is a great question. And in fact, I should tell you in the spirit of transparency that up until 3 years ago, I was not living on this farm. I was living in a very nice suburb of Chicago. I had a very nice, comfortable life because of my corporate job. And even though I grew up here and my family's all here and I owned this farm, I wasn't living here. And knowing rural people like I do, I knew that if I was going to be impactful and effective in reaching people in rural America, I had to once again become one of them. So I moved back to the farm, and I will admit it's not been an easy transition for me for many reasons. But I'm here, and I recently did a meeting in Yates County, and it was one of the most heartfelt and heartwarming introductions anyone's ever given me. And it was very short and very succinct. And the man who was introducing me before a crowd of many rural people said, I want you to listen to him and I want you to listen to him closely because he's one of us. He lives in rural America, he lives on a farm, and so he knows what it's like. So, any doubt I had about leaving my comfortable life in the suburbs and moving back to the farm were put to rest there. But you're absolutely right. That's why we partnered with the Grange because the Grange is in these communities. And so I would recommend you find a group that's already part of the fabric of rural America. Cooperative Extension, for example, FarmNet, many other organizations, the Volunteer Fire Department. Um, these organizations are always looking for programming and always looking for experts to come in. So it's not a matter of you not living on a farm or in a rural area or living on one. It's more of a matter of partnering with somebody who is a trusted individual who can then invite you in, and by association, you will be accepted.
Thanks, Jeff. I think in a lot of work that we do with firearm safety too, the same thing comes up. Credible messengers, right? I think sometimes is the term
Yep.
that we use. I think we have time for one more question that Gina surfaced. How are rural hospital closures and lower access to OBGYN services affecting perinatal mental health care? And how are rural communities responding to these realities?
Yeah. Great question. And again, I would ask you to look at our webinars. So our last webinar we did the end of the year was on postpartum depression and some of the factors around women's health and childcare in rural areas. The closure of rural hospitals has had a huge impact in our area. I mean, we were here in Chautauqua County very concerned about one of the rural hospitals that fortunately was acquired by one of the big hospital chains. And even though some people were against it, you know what? It kept the hospital open. And now they have more services than ever. But it is something that we have to continue to keep an eye on. And again, with the shortage of primary care physicians, many people use hospitals as their primary care, especially if they don't have insurance. So we've got a lot of people that depend on these rural hospitals, and we need to do whatever we can to be vocal and advocate for their health and for their continued existence in rural areas.